blepharoplasty is probably one of the most effective ways of improving periorbital rejuvenation in clinic. Hi, my name is Dr. Mohammed Mohyudin. I'm one of the consultant ophthalmologists here in the UK. So today we're going to talk about upper eyelid blepharoplasty. So what is upper eyelid blepharoplasty? So this is where we remove the excess skin and sometimes the fat from the upper eyelids to give you a little bit more lid show. It's a brilliant procedure which we can do in clinic, and the downtime is very short after. When we do upper eyelid blepharoplasty, we make a very small incision on the upper eyelid which we hide in the lid crease. It heals incredibly well, and after just a few weeks we remove the stitches, and after a few weeks after that the scar is hardly visible. For me, the most important thing to understand is that the eyelid and the eyebrow are one unit. I see lots of patients who come in to me wanting an upper eyelid blepharoplasty, but actually what they want and what they need is a brow lift, because they have low set brows. So it's really important to understand this, and as oculoplastic surgeons we have the intricate surgical nuances to try to not only treat the brow but also the eyelid at the same time. This is why it's important to see a specialist oculoplastic ophthalmic surgeon. The surgery around the eye and the eyelids is incredibly delicate surgery. The anatomy is incredibly challenging, and that's why it's important to see a specialist for this. When you come in for the surgery on the day, initially what we will do is we'll do some skin marking to ensure that we're going to be taking not too much skin. We will give you a local anesthetic injection into the eyelid. After that, after we've done the surgery and removed the excess skin, we will put some stitches in onto the surface of the lids. On the day of surgery, the surgery typically lasts between 30 to 40 minutes. It's done under local anaesthetic with a small injection into the eyelid, and after that get a little bit swollen after on the upper eyelids, and the stitches will remove after 2 weeks. Post-operatively, we advise you to sleep at 45 degrees for a few days and apply some cold compresses to allow the swelling to settle. After just a few days, often patients say the swelling is resolved. They come back to see me after a few weeks and I remove the stitches off the upper eyelid. The eyelid can remain a little bit red and sore for a few days, but often a few weeks after that the swelling and the scar has settled incredibly well. I think it's really important to understand that we provide a bespoke, personalised treatment for each individual patient. We assess the position of the eyelids, position of the eyebrow, and work out exactly how much skin or fat to remove from the eyelids. I think the most important thing to understand is that most patients feel that they look more awake and refreshed after eyelid surgery. But in addition to the aesthetic benefits of this, the procedure can also help improve the patient's peripheral vision, making everyday activities like driving or reading more comfortable.